This is part 2 of the COVID-19 infection control training module. A COVID-19 healthcare WHO standard-based module produced by Debonair Training. Specifically for all healthcare workers, medical doctors and nurses, laboratory technicians, cleaning, delivery, care homes and personal home care. You can use the bottom play bar to control the slides and navigation through this module if you get stuck on any slide. Alternatively, use the next highlighted table of content menu on the left. Note: this training module is best viewed with a laptop or desktop screen size, while it can be viewed with a mobile device. For the best mobile learning experience, please download our mobile app. This is part 2 and Learn It mode. Here, you'll find all the information you need to pass the questions in, apply it. COVID-19. What you need to know. We've come to a point where we hear something about this disease every single day. In fact, there's so much information out there that it's hard to understand what's actually going on. Click the red button below to continue. What is it? COVID-19 is a disease that's caused by a virus called SARS-CoV-2, which is one of several known coronaviruses. These viruses cause respiratory illness. Some of them only cause mild symptoms while others can be more severe. These include SARS coronavirus, MERS coronavirus. Click the next button below to continue. What is its origin? The SARS-CoV-2 virus originated in Wuhan, China. The source of the virus seems to be related to the seafood and live animal market in Wuhan, but we don't yet know what animal it came from. The virus outbreak started with a group of people who exhibited respiratory symptoms. By now, it has spread to other areas in China as well as several other countries. The number of confirmed cases keeps changing daily, but sources indicate that the total was more than 80,000 by the end of February 2020. Click the next button below to continue. How dangerous is it? There are many unknown factors, but it is clear you're most likely to get the virus if you travel to an area where the disease is spreading. There is no need to panic, but you definitely should be careful if you're in an outbreak area. The illness is quite mild for most people, but there are also more severe cases. The mortality rate is reported to be around 3.4%, March 2020. It seems that the virus poses a great danger to older people as well as people with pre-existing conditions. Click the next button below to continue. How does it spread? We still don't know exactly how the virus is transmitted, but it is clear that you can catch it by being in close contact with infected people. Same as any respiratory virus, SARS-CoV-2 spreads through respiratory droplets from the nose and mouth that can land on spaces around you. When you cough or sneeze, you can get infected by touching an infected surface and then touching your nose, mouth or eyes. Breathing in the droplets when an infected person coughs or exhales near you. Click the next button below to continue. Symptoms. The symptoms of COVID-19 range from mild to severe. The most common symptoms are fever, tiredness, cough, sore throat, shortness of breath. Symptoms may appear 2 to 14 days after exposure to the virus. Click the next button below to continue. What is the treatment? There is no treatment for this disease. However, infected people should receive medical care to relieve the symptoms. Potential vaccines and drugs are being developed and tested, but this will take time. Important: if you suspect that you have COVID-19, immediately contact your doctor. Click the next button below to continue. How can I protect myself? Here are some simple tips for protecting yourself and others from the virus. 1. Always wash your hands with soap and water after contact with things you haven't cleaned. 2. Or rub hand sanitizer with 60% alcohol content. 3. Use face protection and know how to use it properly. 4. Stay home except for very essential journeys. 5. Keep social distancing of at least 2 meters from people not members of your household. Note: information on protective measures may change. Please consult reliable sources for the latest updates. Click the next button below to continue. As the virus continues to spread, people are becoming increasingly cautious about traveling abroad. Here are some general safety measures for you to consider. Avoid traveling if you're unwell, especially if the symptoms include a fever, cough, and difficulty breathing. If you start feeling sick while traveling, inform the crew and seek medical attention. Follow standard protective practices. See previous page. If you feel unsure, it's always best to consult your doctor and local authorities before traveling. Note: information on protective measures may change. Please consult reliable sources for the latest updates. Click the next button below to continue. Stay informed. COVID-19 is still very new and data keeps changing every day. There is no need to panic, but it's wise to stay informed. Make sure to look for updates from reliable sources. Think critically, especially when it comes to information that you see on social platforms. Sharing unreliable medical information is very irresponsible and dangerous. We hope you found this crash course on COVID-19 helpful. Stay safe. Click the forward arrow button to continue. Then, if you're viewing this infection control simulation via Debonair YouTube channel, you can interact directly with the online training module by clicking on the link in the YouTube video description. For more incisive training slides, to expedite the end of this global pandemic, and to minimize the damage to our health and economy, you may contact Debonair Training Limited using the following details. Click close to exit or use the bottom play bar to go through the Learn It sections again if you want.